Hey, I'm Dr. Hamlin. I'm a physician with type 1 diabetes, and today I'm going to talk about type 1 diabetes burnout. We're going to go over why it happens and how to heal. If you've ever felt overwhelmed with your diabetes care, you're probably not alone. Diabetes burnout is symptoms of emotional exhaustion, detachment, and the feeling of powerlessness when it relates to our diabetes care. In fact, studies have shown that 22 to 44% of adults with type 1 diabetes experience burnout at some point during their journey with type 1 diabetes. That actually can increase the risk of lower glycemic control, meaning blood sugars that are running out of range more than we'd like them to, and it can increase the risk of depression. What can cause diabetes burnout is the constant glucose monitoring, fear of complications, and even the social burden. What we find that are effective strategies to help with diabetes burnout in the medical literature, cognitive behavioral therapy is a type of therapeutic approach that would be done with a licensed therapist that allows you to look at where your feelings are coming from and reframe them in a way that feels better. We also know that peer support in diabetes communities can make a big positive difference. And reducing perfectionism and setting achievable self-care goals. If you struggled with diabetes perfectionism, I have another video that I will link here. It really can be helpful to change our relationship with it. If you are experiencing diabetes burnout or you've experienced it before, you're not failing. Burnout is common and it's treatable. I recommend you seek support with your diabetes physician and look for communities in your area. In fact, the ADA identifies that constant behavioral demands of diabetes self-management, so medication dosing, glucose monitoring, dietary management, physical activity, disease progression, and social stigma are all key contributors to diabetes distress. The American Diabetes Association also recommends screening for diabetes distress at least annually in adults and more frequently when treatment goals are not met. During transitions like going to college or moving to a new state or in the presence of complications. There are validated diabetes-specific tools or questionnaires that can help us screen to see what type of support would make the most sense for you. The American Diabetes Association recommends addressing distress with diabetes self-management education, cognitive behavioral therapy, mindfulness-based therapies, and peer support. A referral to a behavioral health professional can be helpful, especially someone with diabetes expertise. Addressing diabetes distress improves adherence, glycemic control, so overall blood glucose management, and quality of life, and that the distress is distinct from depression or anxiety. We know that treating it or addressing the cause can improve quality of life. And I think that's so important because often diabetes distress and diabetes burnout can impact quality of life in such a way where it can be challenging to get out of it. That's why we have these recommendations for behavioral health, the cognitive behavioral therapy, mindfulness, peer support, groups, and further education. If you are stuck with diabetes burnout or diabetes distress, know that you are not alone. This is very common. Again, 22 to 44% of people with type 1 diabetes experience this at some point. And it's helpful to know that there are tools out there that can help you with this, that you don't have to figure it out all on your own. I know it can feel like that often when we have so many questions about our diabetes that can be challenging to find answers to. But we've got these evidence-based studies to say that there can be a positive improvement. If you are going through a chapter where you feel like you're experiencing diabetes distress or diabetes burnout, in addition to speaking with your local physician about it and finding local resources, I've created an online course to help people walk through changing their relationship with type 1 diabetes. And it really looks at burnout and distress, what we can do about the way that diabetes tasks are impacting our quality of life. It helps us to really look at the relationship we have today with type 1 diabetes, what we think about it, what it means for our life. If you're interested, this is a pre-recorded, self-paced online course that is 6 modules recommended to be done every week for 6 weeks, and it is available on my website, so I will link that below. Each module is led by me, and each module gives you a series of actionable steps to work through each week. If you haven't already liked this video, that would mean a whole lot to me, and please subscribe if you're interested in seeing more. I will have the course linked below with some additional resources and the references for this video. Thanks for sticking to the end.